Hey folks, I have Jourdan Delacruz who is joining me today. She's an intern of mine, and as you all know, I asked Jourdan to do this presentation on colon cancer and health for men.
Hi, thank you for having me.
Thanks for coming. I'm excited to have you join. What I'd love for you to do is I'd love for the audience to kind of get to know you a little bit. Why don't you give them a little bit about your credentials and a little bit of background?
Hi, everyone. I have a bachelor's degree in nutrition and dietetics. I got that from the University of Northern Colorado. And then I'm also currently working on my master's in nutritional science with a specific concentration in sports nutrition. I'm in my outpatient rotation with David and Orozco Nutrition. Super excited to be here and to present on colon cancer prevention for men.
Just as a little background, unfortunately, I mean, my mother passed away due to colon cancer. And I know you're going to talk about this, but prevention is such the key to all of this. My mother didn't get diagnosed with colon cancer until she was in her late 60s, early 70s. So this is something really near and dear to my heart. Genetically, I am predisposed to developing colon cancer just because it's in my family. So I'm really excited that you're taking this nice little spin on working with men for my men's group as well. And I know the guys are really going to enjoy hearing this. So, yeah, why don't you go ahead, take it away?
So I want to kind of take this presentation through like a story I created. So I want to start off with introducing my character. This is a fictional character. I'm not calling out anyone specifically, but his name is John. He is a 48-year-old male. He's married, has 3 kids, and works in finance. And like most of everyone, he lives a very busy life these days. And for him, he just does not feel like he has time for exercise. He does eat a predominantly Western diet and enjoys the daily beers at night for sure. At a recent family gathering, he was talking with his sister about some of the signs and symptoms that he's been having recently that just are a little bit off for him. And this was a great conversation because it sparked his sister to think, well, our grandfather used to have colon cancer and his symptoms kind of sound like what you're going through. So maybe you should talk to your doctor and see what's going on. So that kind of sets the scene for our little presentation today. So what is colorectal cancer? And I know I just introduced the presentation as colon cancer, but just for reference, colorectal includes both the colon and the rectum in colorectal. And that's really just to include two different organ sites of where polyps, which are these growths. I have this picture here that shows these circular spheres. They grow on the inner lining of either the colon or the rectum, hence colorectal cancer. That if I refer to colon cancer, I am just talking about the colon. But these polyps, they aren't always cancerous. They can grow and accumulate without them necessarily being cancerous. That's why screening is really important so we can recognize the how many are there and if they were going to become a problem. When it does become a problem, it's because these polyps, they attach pretty deeply into the inner lining of either the colon or the rectum, and then they can spread into the blood vessels and the lymph nodes. And not that differentiation signifies what stage of colorectal cancer you could be in.
All right. This is really interesting, Jordan. They kind of look like it's a bubble. A tube is like, you go to the circus and that guy's making you these funny hats with balloons. It
Oh,
looks
yeah.
like the inside of the balloon has these little marbles or pearls that are connected to the wall of the balloon, right?
Yeah,
Yeah.
that's a great illustration.
Yeah.
So colon cancer or colorectal cancer, we should care because it is the third most common cancer worldwide. And unfortunately, 1 in 5 colorectal cancer cases are now in people under the age of 55. So this is no longer a quote unquote old person's problem. This is all of us problem, right?
Yeah, and I think he was mentioning about screening and how the reason it was seen in people 70 and older is because no one was ever screened before then.
Mhm.
And so it's interesting that we're seeing it sooner and earlier, especially in men.
Yeah. Maybe that's indicative of just evolving technology or evolving awareness of screening. Maybe that has something to do with it. I don't know, but
Well, I mean, it's also part of social determinants of health, right? I think that people having quality access or access to quality healthcare is
Mhm.
very important, right? So looking at socioeconomic levels and the country that you may be in, obviously here we are here in the United States, so access to care is relatively okay, but
Mhm.
we're getting screening a lot sooner, so obviously we're seeing it a lot faster. But I know you'll talk about that more in a minute.
Yeah, yeah. Right now, I want to highlight some of the risk factors. So, just like John discovering that his grandfather had colon cancer before, he knows that now family history is a big risk factor, and also David, like you mentioned with your mother. Other things like genetic, concurrent health conditions, so specifically ulcerative colitis, Crohn's disease, or diverticulosis. Those are diseases that involve inflammation throughout the digestive tract. So those are, if you have those, that would further increase your risk of developing colorectal cancer in the future. In terms of ethnic groups, American Indian, Native Alaskan, they were ranked as number one, and African Americans were close second. And then I love living is a risk factor. So if you have the privilege of living beyond the age of 50 and older, unfortunately, you do just carry a greater risk. And so we'll go into the importance of screening. That will be a common theme here in this podcast. But on the right side, there are many modifiable risk factors. So that means things that we can actually control and change. That includes smoking, if you drink alcohol, your level of activity and diet, and we'll go into more detail in an interval. So I did want to highlight stress and trauma and how this would further increase our risk of developing colorectal cancer, and specifically the gut-brain axis. The gut-brain axis is the interaction between the intestine, microbiota, and the central nervous system, primarily through the vagus nerve. Now, the microbiota, I'm referring to the gut microbiome, which is the host of multiple, like billions, trillions of microorganisms. Microorganisms exist all throughout our body, but specifically today we're talking about those that reside in our gut, so large in the large intestine. And stress, so chronic exposure to stress, even trauma, can influence dysbiosis of the gut microbiome, which means there is an imbalance between the good bacteria or beneficial bacteria and the bad bacteria. So, bad bacteria being those that maybe increase inflammation or they release toxin. Good bacteria are those that we know in the literature have been shown to have a beneficial relationship and outcome with the human host. So that would be us. You know, they probiotics. These are live microorganisms in our gut. When they are flourishing, they will actually produce short chain fatty acids like butyrate. And these have been shown to have a beneficial relationship. So, with chronic stress, with exposure to trauma, this can influence the state of our gut microbiome, which in a state of dysbiosis would further increase colorectal cancer risk and also treatment outcomes. So, how well you respond to treatment. Now, I want to take a second to highlight that there are some sex differences in terms of prevalence with colon cancer. Male rates and cases are a little bit higher than female. And the American Cancer Society estimates that over 100,000 new cases of colon cancer will occur in 2026. Reasons why men may be more vulnerable to developing colorectal cancer. It could be due to biological or behavioral factors or some combination of the two. Examples could be dietary habits. So men are more likely to consume red meat, have a lower fiber diet, and engage in alcohol and smoking behaviors. Loneliness is a big problem, especially for men in their middle age and beyond. And loneliness is associated with poor mental and physical health outcomes. Men are also less likely to seek medical help and are just less aware of different screening recommendations and signs and symptoms. Not to say that women are healthier, but women do typically are they're just more conscious of their health, longevity. Maybe they're thinking of nutrition a little bit more than a typical male would. So, signs and symptoms, this is a really important tool to have in your back pocket is to know what to look for. Any changes in bowel habits. So, for one, if there is blood in your stool, you should always, always, always seek medical attention. And then other changes that I think we experience, and not all the time, but certainly throughout our lives are diarrhea, constipation, or just this feeling of dissatisfaction with going to the bathroom in the morning. So if we feel like we didn't really get it all out, those can be signs that this is chronically going on.
I always love talking poop with my clients. They get so embarrassed.
Oh, I love talking about poop. I think
Yeah.
that's probably why I pursued study.
I think that it's so important to know that every single human poops, and when you don't, it's a problem. And what it looks like can be very revealing. I also think that blood in the stool will make the feces smell a little bit different. And then the feces can actually be dark as well, if I'm not mistaken. So blood in the stool may not always look like blood in the toilet, but the feces itself, can look really darkish, dark brown, and may have red streaks in it, but not always. So it's important to really look and know what your poop looks like. It's actually good to look at it, believe it or not.
Oh yeah, because you'd be able to tell if your stool is a little darker than normal, or yeah, if you do see those red streaks or anything like that. Other things to keep in mind: any pain or aches or cramps in the stomach, the lower back. Another thing, unexplained weight loss. So in a society that celebrates weight loss, it's a little unfortunate that it could very easily be glorified when in actuality, it's a cry for help. It's your body saying, "Hey, there's something going on, and you really need to seek care." If there was no big changes in your diet or activity level, and you were just losing weight for you can't really think of a reason, that is a sign. That is a sign that we need to seek medical attention. Also, fatigue due to iron deficiency anemia. So let's say you're a little bit more tired throughout the day, and even if you added, an additional 1 to 2 hours more of sleep at night, which is great if you can in general, but if you're noticing that you're still tired throughout the day and you can't figure out why, it could be a case of some anemia, which is common in colorectal cancer due to chronic bleeding of the tumors. And then sometimes there aren't any symptoms at all, which is a bit unfortunate, but that's where the preventative screening becomes really, really important.
Yeah, and I really love that you're touching on a few of these, especially the pains, aches, and unexpected weight loss. It's not to say that unexpected weight loss or unplanned weight loss and fatigue or lower back pains means that you have colon cancer. And I think that this is the problem with Google diagnosing, actually. Where we look up things on Dr. Google and think, oh my God, I must have colon cancer, as much as what you emphasize here about the importance of screening. But it is interesting that weight loss is tied into positive outcomes. And here you're using a really good example of how it's not, right?
Mhm.
And then fatigue is another one that's really interesting. I hear a lot of people tell me about fatigue quite often. And you don't realize that iron deficiency anemia, essentially feeling fatigued, because you don't have that oxygen carrying capacity that you have in red blood cells.
Yeah, of course. It's all important. And, I want to bring back John, or, our fictional character here. He did go and see his doctor and he discovered that he had stage 3 colon cancer.
Mm.
And he's wondering what he could have done to reduce his risk. And this is where I really want to highlight prevention. I mean, we've probably used the word prevention over 20 times already, but that's key. That's key to a lot of disease and cancer and just overall health, but especially for colorectal cancer. And so a big part of this is gut health. And when I say gut health, I'm also thinking of the gut microbiome, which we talked about earlier. And there is a relationship because, how healthy or how diverse and lively your gut microbiome is, that can alter colorectal cancer susceptibility and progression. And this is something that we can control. I do know our gut microbiome, a lot of it is established at birth, but that doesn't mean that we can't improve. And so the big key to this is fiber. When I say gut health, I also want you to think of fiber. Fiber is a prebiotic, which means it feeds our probiotics. Probiotics are live microorganisms. Like I said, we have living bacteria all over, but specifically in the gut, we're talking about gut bacteria. And we want to feed those good gut bacteria. Because like I said, it helps to promote multitudes of human host benefits. And whenever I like to talk about fiber, I do like to break it up in 5 different categories because I don't like just throwing out fiber like it's this single entity. There's multitudes of fiber, and we actually don't. Research is still continuing to explore all these different kinds of fibers and what their benefits might be for us as humans. So it's not just this single entity. So I do like to break it up into 5 categories. 1 being whole grains. 2nd is fruit. 3rd is vegetables. 4th are legumes, so like beans, peas, lentils. And then 5th are nuts and seeds. Specifically, I'm thinking like almonds, pumpkin seeds, chia seeds, hemp seeds. Those are all really great sources of fiber.
You mentioned something that's really interesting. You said that fiber are prebiotics. What does that mean?
So prebiotics are the food for our probiotics. And fiber is a type of carbohydrate, actually. The difference between this kind of carbohydrates versus starch or like glucose is that we actually can't digest it. And so it'll make its way all the way through the mouth, the stomach, small intestine, down to the large intestine. And it is now the fuel source for our gut bacteria. And they can eat it almost like the way that we process sugar. So that's why I say fiber is a prebiotic and it is a fuel source for our probiotics or our gut microbiome.
Awesome.
And then, of course, we do have to talk about misinformation because I do just think that is now a prerequisite topic when you're talking about nutrition, unfortunately. If you've ever heard of like different colon cleanses or gut reset trends, colonics, parasite cleanses. I've seen my apple cider vinegar gut shots, detox drinks, all those kind of things. It's really important to point out that this does not actually clean your colon. It doesn't prevent colon cancer, and it would not treat colon cancer. What it may do is it may make you feel better because you've been backed up, you've been constipated, probably because you're not eating enough fiber, and you may feel better afterwards, but it does not help in the case of colorectal cancer. The only way to do this is through screening, and if there are polyps, then they could be removed. And in terms of treatment, if you do have the colorectal cancer, you would have to do, and we'll talk about this a little bit more, but like surgical or chemotherapy, those are what we know treat colorectal cancer, not any of these products or activities you could do. That is just purely misinformation. Other things like gut health products, so probiotic powders and gels and gummies. The problem with this is that the research in microbiology, specifically on probiotics, is still, we're still learning. There are so many types of bacteria, and we're just scraping the surface. So we don't really know what strains are going to be helpful. We don't know the efficacy of taking a probiotic via pill form. So would that strain make it through the swallowing, through the acid of our stomach into our large intestine where it needs to colonize for it to actually have any benefit? We don't know if that actually is happening. So really the best way to get your probiotics is going to be through fermented food like sauerkraut, kimchi, yogurt, that kind of stuff, versus these probiotic pills that are just everywhere.
It's really important that you bring all of this up. I think that the misinformation is somewhat very challenging, especially for dietitians like ourselves in our field. Health professionals have a sort of dual challenge in that not only is the misinformation spreading like wildfire, what happens is it takes twice, three, four times as much information and work to disprove something that is misinformed than it does to spread. The other thing too is you're working against the algorithms, especially in social media, that are designed more to things that are frightening or disgusting or challenging or sensational, right?
Yeah, a boring nutrition, like saying, "Oh, just have a balanced diet."
Yeah.
Doesn't sell.
No. Right. It's not sensational. It's not cool.
Right. But speaking of which, that is how you help prevent colorectal cancer is a balanced diet. I love using the mind plate as an illustration. So think of your standard 9-inch plate, divide it into like a quarters or four. And so about a quarter is going to be made up of lean protein. Another quarter will be made up of starches. So if you use like corn tortillas or beans, those starches also have quite a bit of fiber, which is great. And then the other half should be made up of vegetables. And then you also have your little serving of fats as well. So maybe think of like a scoop of guacamole, which also is a great fiber source. But if most of your plates look like this, I would argue that you have a pretty balanced diet, which is really great. And you're also getting in a lot of fiber. For men, the goal at minimum is 38 grams. This is the RDA. The amount is important. You do want to reach that 38 grams, but thinking back to those 5 categories, the whole grains, fruits, vegetables, legumes, nuts, and seeds, the importance is to also grab fiber from all 5 categories. There are plenty of high fiber foods. Like I'm thinking the Mission low carb tortillas that have like 15 grams of fiber per tortilla. So if you technically had two, you would be pretty close to that 30 grams of or 38 grams of fiber. But what you're missing out on is insoluble fiber. You're missing out on resistant starch. Like again, there's so many different types of fiber. So that's why we recommend that you get diversity. You get a variety of different sources. So for us everyday eaters, if we're getting something from the whole grain section, we're getting a fruit, we're getting some vegetables, getting some beans, and any kind of nuts and seeds. I think that is probably the best way to be very consistent about getting diversity in your diet. Another thing, reducing red meat consumption. So it is recommended that you have less than 3 portions, or this is like 3 ounces or a small palm size per week. And this is because processed meat like ham, bacon, sausages, these are actually group 1 carcinogens, which are known to cause cancer. And then red meat, so like beef, lamb, and pork, these are group 2A carcinogens, which means that there is a strong probability that it causes cancer. So that's why reducing red meat consumption, and you can replace these with plant proteins because you're also getting fiber, is really helpful. So for lifestyle, things that we can do to help prevent colorectal cancer, movement. As much as diet is important, so is movement. The recommendation is to get 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity activity each week, or some type of combination of these. If these numbers sound scary, I would suggest that you start off with just prioritizing going on a walk daily. It doesn't have to be like we go in and we do a crazy bodybuilding session. I know David would not recommend that. He is, I have
I
sat in
wouldn't.
with enough, yeah, I've sat in enough counseling sessions with him, and he has his client pick one thing and make it a habit. So if the numbers sound scary, start with a walk. Start with taking the stairs versus the elevator. These are simple changes that all contribute to your movement and contribute to your overall lifestyle. Like, do you embrace an active lifestyle?
But what do you say to people if they say something like, I have joint problems or I have issues with sweating? I don't like sweating. How do you work around that?
Well, I do know with joints, there are lots of different ways that you can move your body without it being so repetitive in terms of the compact, like running. I mean, that's literally you're just repeating over and over, um, your ground hitting the floor like over and over, right? So that can be problematic for knees and ankles. But like swimming doesn't have the issue with joints usually, or using the Peloton. That's also a great option for people if they do feel like that they have limitations because of aches and pains. And sweating, if you don't like sweating, you don't have to do this high intensity exercise to live a more active lifestyle. Other really important modifications that we can make are to don't smoke. And same with alcohol. If you don't drink alcohol, don't drink alcohol. I think a lot of people will say if you do drink alcohol, they're just have it in moderation, though that is kind of vague, to be honest. And the reality is there is no safe amount of alcohol. There is no amount that is recommended. So the idea is to reduce your intake or abstain completely. So what I feel like is the top of our mountain that we've been climbing is screening. This is one of the biggest, most important part of colorectal prevention. And the gold standard is going to be a colonoscopy, which this is a procedure that uses a camera to examine the entire colon and rectum for polyps. Now, a colonoscopy can take anywhere from 15 to 30 minutes. They do say it's minimally invasive, though I do want to point out it is a bit more than just getting your blood work or getting a flu shot. It does require usually a bit of a bowel prep. So that is usually some type of clear liquid diet and laxative use for 1 to 2 days prior to the exam. This is just so that the colon is clear enough for the doctors to get good imaging. They are looking for very specific, the polyps. And if they can't see it because there's a bunch of stuff in your colon, then it would not be very effective. And then usually the recovery is like 1 to 2 hours after the exam, and you can resume normal activities. For those with average risk, they say around every 10 years. But again, if you remember those risk factors, and like John, in his case, he had those signs and symptoms. He had the family history. We saw his lifestyle. He doesn't really work out. He drinks regularly. He has a pretty predominantly Western diet. All of that increased his risk. So the frequency of the amount of times you would go and get a colonoscopy would shorten maybe around 5 to 7 years. It really just depends on you and what your doctor would recommend. So for treatment, we're checking back in with John. His doctor recommended a partial colectomy to remove the cancerous sections of the colon and surrounding lymph nodes. And he was also advised to consider adjuvant chemotherapy to reduce his risk of reoccurrence and mortality. So when you go in and get a colonoscopy, if they did find polyps, cancerous or not, they will remove them, and that's called a polypectomy. If there were cancerous polyps and they've spread, depending on the stage, the most common treatment is surgical route, and it's a colectomy, which is, again, is the removal of either the colon entirely or partially. So they'll just remove the cancerous section. And then other treatment modalities would be chemotherapy, immunotherapy, and radiation. So for remission, let's say you had the colon cancer, you got the treatment, it was successful, you no longer have it, which is awesome. The journey is not over. So you would have to have follow-up testing schedule, like a pretty rigorous testing schedule with frequent visits with the doctor and colonoscopies. So especially in those first 2 to 3 years after treatment, you will have to continue to get those colonoscopies. And there are also long-term effects, especially if there were any changes to your colon. Like we said, a partial colectomy or the full removal. This can cause some GI symptoms like gas, bloating, constipation, that it's a long-term treatment effect, unfortunately. There are ways that you can help, but it can happen, and it does happen for a lot of people who are in remission. And then just because you get into remission, it doesn't mean you'll never get it again. And you have to continue with preventative measures and lifestyle changes. So that's why working with a registered dietitian is really important, because you can then make those nutritional and lifestyle changes. And then also there's psychological and social support. Not everyone experiences cancer the same, usually pretty traumatic, and there's a lot that goes into it, even if you did go through remission. Another example is if you had the full removal of the colon, so you had the colectomy, you will have to live with an ostomy bag, which is this bag that is attached. It would sit on the lower side of your stomach and essentially where all your stool goes. And there's a lot that goes into that. Living with an ostomy bag would not be easy. So having that psychological and social support is really important, well beyond the cancer itself.
My mother had an ostomy bag, and it was interesting because she would stand next to us, and you could actually hear some of it move. And it's not a pleasant thought, unfortunately, but it's quite embarrassing. I say it not to scare people, but it's something that is difficult. So it really, really emphasizes the importance of early screening. And it's so interesting because early screening can sometimes just be something that people don't even think about, people don't hear about, people don't understand. And emphasizing the importance of early screening is key, because you could still do all the right lifestyle preventative stuff, and you could still develop colon cancer. It's not a foolproof approach to prevention.
Okay.
So early detection is really key, from what I can tell you, experiencing myself.
Mhm. Yeah, absolutely. And yeah, and now checking in with John, he is in remission and wanted just to see what he's up to. He has adopted a more plant forward, high fiber diet. I like the word plant forward because plant based or vegan or vegetarian can be really restricted for people. So I think just saying, hey, like make sure most of your plate is made up of some type of plants or a combination of plants is a really good way of looking at it. Because remember, John went from a predominantly Western diet. So focusing more on just having the basis of plants out of all of his meals was really helpful for him. He also joined a basketball league for not only regular physical activity, like we talked about is really important, but also for community. John, he's middle aged, he's got a family, which is great, but also it can very easily mean that he just doesn't have time for friends or like outside extracurricular activities per se. So this basketball league is really helpful for not only his physical health, but also his mental health. And then, of course, since he did get surgery, he will need to do another colonoscopy a year after. That is booked on his calendar.
Go, John.
So to sum it all up, early detection is key. 90% of colorectal cancer are treatable when diagnosed early. If you take anything away from our talk today, I just hope that you consider regular screening. Other things that are really important are a balanced diet that's full and rich in fiber. Reduce your red meat intake, sugar sweetened beverages, and ultra processed food. And then consider ways that you can get more active. Again, you don't have to sign up for a 5-day program that would take 2 hours in the gym, right? Like just start off slow and get regular screening. And of course, manage stress because, as we know, psychological health also plays a big role in our physical health.
American Academy of Gastroenterology recommends for screening levels age 45 and older. If you have a family history, age 40 and older. If you have polyps, you want to do it every 3 to 5 years. If you have no polyps, it's every 5 to 10 years.
I have a list of resources that I used for our talk today, and David will include those in the presentation or podcast notes. The biggest takeaways are screening and fiber. So thank you all for allowing me to be here, and hopefully this was educational and impactful.